everyone, I'm Briana. So I was a fellow spring 2020, my last semester in the program, and I went to Costa Rica to do a project for the Ministry of Health in Corredores. And so my project is called Para Vivir una Pura Vida, which means to live a pure life. Pura vida is a common phrase in Costa Rica that's a greeting. Also, it's pretty much symbolic to the lifestyle there, and I did a literature review and recommendation report on adolescent suicide prevention strategies. So, the main objective of my project was to answer the question, what is a culturally appropriate adolescent suicide prevention strategy, and what recommendations should the Ministry of Health in Corredores consider when implementing the suggested strategy? So, I answered this question by first doing a literature review of about 45 articles exploring the risk factors for adolescent suicide prevention as well as the best strategies for adolescent suicide prevention. There was not a lot of data that was specific to Costa Rica and definitely not really specific to Corredores, so I had to look at similar contexts in Latin America. And then to further triangulate the data, I wanted to send a survey out to relevant professionals in Costa Rica. They were originally supposed to be key informant interviews, but COVID happened, so I had to switch it to a survey. And so the professionals that I sent it out to were either in the Ministry of Health, they either were or they worked at PANI, which is the National Institute for Child Welfare, were in the psychiatry field or school administration. So for that survey, I wanted to see whether the strategies that I found in the literature review, if they were deemed as acceptable to actual professionals who would be the ones implementing such a strategy. Also, I wanted to see if there was any underlying nuances that maybe obstacles that adolescents in corredores face that are different from adolescents in other areas. And then I boiled that down into recommendations and as well as outlined a possible intervention that the Ministry of Health could implement. And on this slide here, it pretty much underscores the importance for such a project. As you can see on the chart, that the suicide rate in corredores is much higher than the national suicide rate. And then also on the map, you can see that Corredores has a moderate suicide rate when compared to other cantons, which are like counties in Costa Rica. And even the neighboring county, Golfito, is much lower suicide rate than Corredores. So that made it even more interesting to explore. I did really dive deep into the risk factors for adolescent suicide prevention, and I found a lot of really interesting risk factors that I would have never considered. But for the interest of time, I won't go into it because I can talk all day about that. So for adolescent suicide prevention strategies, these are the 5 different types of strategies that I explored. And community based interventions and school based interventions were the two that I really highlighted the most in my intervention example because one, they were deemed as appropriate based on the survey results, and also they were both found to be very effective in the literature when used together. And so for the survey results, the results pretty much highlight or emphasize what was found in the literature. And so 73% of people who participated in the survey said that the best method is to combine multiple strategies. I also asked them about peer-based methods like doing peer gatekeeper training because that was something that the Ministry of Health was interested in. And 14 out of 15 participants said that they believe that that would be a good strategy to include in the intervention. The one person who didn't say that it was a good strategy, he didn't completely rule it out, but he was a bit hesitant because he questioned the maturity of adolescents and the responsibilities of dealing with gatekeeper training. Also, something interesting that came out of the survey results was that family dynamics was the most reported obstacle for adolescents that may be a risk factor for adolescent suicide. So I definitely incorporated that in my intervention example. So then my recommendations. So these are some of the recommendations that I suggested. Regional collaboration was a big one because Corredores is on the border of Costa Rica and Panama. So it only makes sense to really include Panama in some of the work since the border is very porous and there's a large migrant farmer population. Also, Corredores is within the Brunca region, which is a cultural region named after the indigenous Baruca people. And since it's within that region that also is on that border with Panama, it would be helpful if they did some comprehensive health surveillance system disaggregated by indigenous group, because that has not yet been done. Also, having a multi-pronged intervention is something I suggested. That was in the literature and almost every article, that you can't just use one strategy, you have to intervene on multiple levels. So I did utilize the social ecological model when I did create my intervention outline. And then also getting more Costa Rica based research was something I really, really emphasized in my presentation to the Ministry of Health. There's a huge gap in the data when it comes to adolescent mental health research coming out of Costa Rica. Also, doing some CBPR work I thought would be useful. Getting the community involved in any way possible would be helpful to decrease the stigma that exists there regarding mental illness, as well as training different people in the community to be gatekeepers. And then to evaluate whatever they choose to implement, to evaluate it regularly, because especially with adolescents, the obstacles that they face can change very quickly. And even now with the pandemic, I'm sure the obstacles look much different than they would have 2 years ago. And so this is a little bit of the outline of the intervention example that I came up with. And so I called it Camino, which means path or way. And I kind of made this analogy for life being like a road with many twists and turns and obstacles. But no matter what, there's always a way. So that's kind of the slogan that's there. En el viaje de vida siempre hay un camino. In the journey of life, there's always a way. And I emphasize this type of messaging to kind of deep take the stigma out of it, to help it be more accessible to adolescents. That's also why I used the bright colors. And then I incorporated mountains in the background as something that's familiar to them, because it reminds them of their landscape of where they live. So then for the individual level, I suggested doing a print media and social media campaigns, as well as enrolling adolescents in a text reminder service to inform them of mental health resources in Corredores. This could include alternative forms of wellness, such as art therapy. For the interpersonal level, I suggested doing peer gatekeeper training. So training adolescents over the summer so they can be gatekeepers for the next school year, providing some sort of incentive for that. And that training would cover basic mental illnesses, as well as the QPR model, which is question, persuade, refer. And then incorporating role playing is also a crucial factor that came up a lot in the literature, because it helps to take the stigma out of it and to promote confidence. I also suggested doing a parenting curriculum, since in the survey, family dynamics came up a lot as a potential risk factor for adolescent suicide. So training the parents to be gatekeepers, but also teaching them how to empower their children, promote resilience, and understanding obstacles that adolescents face. Then for the institutional level, I suggested doing two different school-based curricula. So one being an essential skills training, and that would be not specific to mental illness, but to promote protective factors for mental illness, such as positive coping mechanisms, increasing help-seeking behavior, high self-esteem, body positivity, etc. And since this is not specific to mental illnesses, this could start at a younger age, such as age 10, and can be adapted each year for maturity. Then for the suicide prevention and awareness curriculum, that one would be specific to suicide prevention and talk about different mental illnesses, how to help friends going through that, and also how to recognize certain risk factors in yourself, which would start at adolescence, being age 12. And then for the community level, I suggested conducting an evaluation on screening and referral protocols in the ABAIS throughout corredores. And the ABAIS is like the health centers where all the different health professionals are. And also to create a surveillance system to compile epidemiological data disaggregated by sex, age, indigenous group, etc. Also creating a CBPR task force and facilitating community gatekeeper training. So that was pretty much my project in a nutshell. I really enjoyed this experience, probably my favorite one throughout the whole MPH. Really also a proud moment for me. The Ministry of Health did say that they could see themselves implementing something very similar to this. So thank you.